when we think about the patient safety agenda, and we think about some of the figures from the World Health Organization that suggest to us that there's probably a 1 in a million chance of having a problem in an aircraft, having an accident in an aircraft, whereas there's a 1 in 300 chance of somebody having an adverse event when they're in the care of individuals within hospital or in community services. And that, when we think about pressure ulcers then, we know that the prevalence of pressure ulcers in Ireland, the mean prevalence is about 16%, whereas the mean incidence is about 11%. And when we think about what that means for the individual and what it means for society as a whole, probably about 2 to 4% of our healthcare budget is being spent on the prevention and management of pressure ulcers. And if we think that these could be avoided, then we know that we can make savings in that area in terms of being able to have money to put into other aspects of care. But as health professionals then, our key concern is about the patient's experience. And we know that pressure ulcers have a really negative impact on the patient's health-related quality of life. In fact, it affects all of the domains of the activity of daily living. And what really hits home to me is that one of the most important things that patients complain about is that they have pain, consistent pain. And if you could imagine what that would be like for you to have pain 24 hours a day, 7 days a week, 52 weeks a year, and then you're asked to do activities to try to help yourself to recover, but the pain in itself may be something that's actually impacting on your ability. For example, in a recent study by Spilsbury et al., she's looking at the experience of pain, but others like Alison Hopkins in her study has explained to us that patients say that they sit really still because the pain is so bad. And we know in terms of pressure ulcer prevention that really we need the patients to move. So we have to think about what it is and what it's like for that person to experience it. And I think bearing in mind the cost that it impacts on the health service as a whole and on society as a whole, and then putting into context the experience of the individual, really brings it home to us the importance of prevention. Because in the many of cases, the pressure ulcers can actually be avoided by adherence to good standards. And I think that's, for me, it's really great that this collaborative is looking at pressure ulcers, because of course it could look at many different areas, and we know that the collaborative is about getting teamwork together, about getting people to take ownership for the issues that are arising within their own clinical practice, putting into interventions that will work for them and their patient groups, and then being able to report and take ownership for the outcomes of that. And to see such a large number of people in the room today doing this pressure ulcer collaborative is fantastic, because we've been lobbying for this for many, many years. We've lobbied in the EU, we've lobbied nationally and internationally, and we have had some success from the EU perspective, and MEP Rossi has included pressure ulcer prevention as being a key issue in his initiative on patient safety. But I think that what we're trying to do is to make sure that we have the issues around, for example, the skin bundle, which forms the basis of the interventions in terms of this particular collaborative. And there's a lot of evidence to support that, and the European Pressure Ulcer Advisory Panel and the National Pressure Ulcer Advisory Panel in the States are working on updating their guidelines, which will be ready in 2014. And the initiatives within the skin bundle, which look at skin assessment, it looks at the surface that the patient is lying on, looking at keeping the patient moving, managing incontinence, and making sure the patient is nutritionally stable. All of those are well founded in evidence. So it means that not only are we bringing forward a collaborative for people working together, but we're also making sure that there is a good adherence to evidence-based practice, and also that we're measuring outcomes so that we are in that continuous quality cycle, as it were. So for me, these are the really key issues, and it's so exciting to think that here we are working together to drive the agenda of change forward in terms of pressure ulcer prevention, and I'm really delighted to be a part of this.